Good afternoon, everyone. Thank you for joining us today. Jana Castleberry and Melanie Reese. They are with the Primary Care Office at the State Department of Health. And they're going to be sharing and presenting about the upcoming certification cycle for the National Health Service Corps. I know we receive a lot of questions about this throughout the year, and so this is a great opportunity to bring those questions and kind of talk through this process. We are a smaller group, so if you have any questions, please feel free to put them in the chat. You can unmute your lines. If you're watching this recording, please do not hesitate to email me or Jana or Melanie, anyone with your questions or concerns. And with that said, Jana and Melanie, I will turn it over to you.
Thank you so much, Laura. I appreciate it so much. Okay, as Laura said, I'm Jana Castleberry, and Melanie Reese is our Office of Primary Care Program Manager. I'm the director of the office, and thank you so much for having us today. I'm going to tell you a little bit about who we are, so you'll see where it fits within our federal government and our programs. So we're funded by the Health Resources and Services Administration. They are known informally as the Access Agency. They do primarily pay attention to ensuring equitable healthcare access to our highest need communities. And of course, they divide that into high needs, and we usually say underserved and rural communities, because rural areas, as you know, are generally places that don't have enough healthcare providers. The programs support not only low income, but also disease specific, HIV, pregnant people, children, parents, rural communities, transplants, and the health workforce. So we are funded within HRSA by the HRSA Bureau of Health Workforce. Again, this improves the health of people who need it most. They strengthen the health workforce and connect skilled healthcare providers to communities in need. So it's access, supply, and distribution. Where our office fits in this is that one of our primary tasks is to, I'm going to see if I put this on it right. One of our primary tasks is that we conduct a statewide primary care needs assessment. So once every 5 years, we conduct a full-blown primary care needs assessment. And every year or two, depending on the year, we update the provider data and the rural communities data to determine which areas of the state and to what degree are experiencing shortages of primary care physicians, mental health providers, so psychiatrists. We're beginning to be able to assess the mental health providers, the therapists, and the level of LPCs, LCSWs, and that. And then we also assess the shortages of dentists and dental assistants. We do the work to secure the federal health professional shortage area designations. Those are the kind of cornerstone of the eligibility for all of HRSA's programs. So when we say underserved or neediest communities, those depend on the HPSA identification and analysis to the degree of the shortage. So we using these as the base of our work. The health professional shortage designation, also medically underserved designation, which has a different set of data. We use those to guide our work around National Health Service Corps. We provide technical assistance and site certification for healthcare facilities that meet National Health Service Corps loan requirements, and that one of those is located in a health professional shortage area. And another, we'll talk about this a little bit later. We also have a state loan repayment program that's Oklahoma Health Corps. That's an addition, so it's a National Health Service Corps program that is designed at the state level. This was the first year that Oklahoma had it. It's still in development, and we're very close to making awards. That program works with other student loan repayment programs in the state, so through the Health Workforce Training Assistance Center and the Dental Loan Repayment Center. So we coordinate around that. What comes out of that is that our priorities really focus on mental health, although we do fund, at least this year, we'll be able to fund providers who fall outside of that mental health that aren't funded in any of our other state loan repayment programs. We also do the J1 Visa Waiver Conrad 30 program. This might be something that not everybody is aware of, but Oklahoma, every state in the nation, is allocated 30 slots per year that allow us to grant waivers, or the federal government, we make the recommendations to waive for foreign trained physicians who are completing their residency here on a J1 visa. This program allows us to recommend the waiver of that J1 visa requirement that that physician return to their home country for 2 years before they work in the United States. So what that means is that we're able to work with residents completing their residencies who are on J1 visas, but for 30 of them per year, we're able to offer these waivers, support them so that they can begin practice in Oklahoma. And I always want to just encourage hospitals and rural health clinics, any type of provider, if you're having a difficulty recruiting that this J1 option may be an option for you. So, and always we're happy to talk about it at any time. We also have the Oklahoma Charitable Volunteer Provider Program. The state of Oklahoma offers tort coverage to healthcare professionals who are volunteering their time to patients who are determined to not have any other access to primary care. So they don't have insurance, there's of a certain income level on that. So we do run that process once a year. We sign up volunteer providers and they're covered for the full year. In essence, it's not malpractice insurance, but they are protected from personal liability in any of the services that they provide while in the capacity of their volunteer position. So that's our whole workforce development. National Service Corps and the State Loan Repayment Program fit into that. Again, the aim is to assess the workforce in the rural communities and make sure that the rural facilities have the programs in place to try to recruit and retain their providers. We also, and I'll move past this through, the Office of Primary Care is located in the Community Development Services. Our focus, even outside of what we do, is community engagement, partnerships at the community level. Right now, we're really looking at those public health, private health partnerships. As we're transitioning to the Spanish care model, we're transitioning to value-based care. Our team is part of the overall effort to make sure that healthcare facilities are able to improve health, have the resources available to address the social drivers of health, and overcome the very real challenges to access to care in the rural areas. So, of course, we work with tribal too. Oh, I think I'm jumping all over here. So, okay, health professional shortage areas. I put this slide up as a resource for people when they come back. We could, really, if everybody wants a lunchtime nap, we could definitely go over this data, but we're not going to do that. But if you want to know more about shortage designation and what we do and how we score it, please, these are the resources. I will point out we've got maternity care target areas. That's a new designation. It falls within our primary care designations, and it's based solely on the providers who that provide prenatal care. So OB/GYN, this is the only designation that also includes nurse practitioners who provide those maternity care. And then this one, of course, I think most of our rural partners are aware of the need to have a health professional shortage area designation to start a rural health clinic. Right now, it's not too big of an issue because the entire state is a health professional shortage area. But if in the event those health professional shortage areas in rural areas are withdrawn at any time, we can always work with you to secure a governor's designated certified shortage area. Okay, and then again, you're always these data reports, so we'll have updated maps and that on the site. Okay, so HPSA designation. Here's our health professional shortage area with scores. In the National Service Corps world, the scores matter. The higher the score, the greater the need. Most of the national programs fund down to 15, 14 sometimes. So you can kind of tell if your score is competitive. And you can also see just very few areas in Oklahoma are not health professional shortage areas when it comes to primary care. So the low income geographic designation, so low income population, we're looking at the number of providers who accepts Medicaid and provide and based with the ratio of the percentage of the population that falls below 200% of poverty in that area. So most of ours are low income designations. the geographic designation. So we do have quite a few in Oklahoma too. This carries the extra benefit of these critical access hospitals in these areas, and some smaller hospitals qualify for a physician bonus payment on any Medicare services provided. So it's a 10% bonus payment. That is always calculated, should be calculated automatically through CMS. If it's ever a question that you're located in one of these counties, it doesn't look like you're receiving the physician bonus payment, by all means, reach out to us. So,
Jen, excuse me, there's a question in the chat. I'm sorry to interrupt you.
oh yeah, I don't see the chat.
I'm keeping an eye on it. Somebody's wondering when the maps will be updated for this round of designations.
So these are, we'll start the updated process. We'll have a national update in June. That process will go through June, July, August. We'll be updating the data as it goes. I think we have about 3 months to complete those, the provider updates. And it's definitely a challenge this year because we use Medicaid claims data, and that with the transition to Medicaid managed care, we don't have enough data from that transition to assess for shortage areas. So we'll be updating the health professional shortage areas with the data that we do have, and we'll do another round next year. So in the meantime, if someone, always, if you think your HPSA score is not representative of the shortage in your area, call us. We can work with you to do, we don't always have to do a statewide update. If you've lost providers, if you've had an influx of any type of population, loss of sometimes, if a plant or something has closed down in a county, we have a lot of people who are now below that 200% of poverty. Anything that's changed significantly, we can do that upon request. So, and we can look at that, particularly if a provider, if a physician leaves your area, or if they stop accepting Medicaid, or if they start having their PA or the nurse practitioner see Medicaid and they no longer see Medicaid. Those are the changes that sometimes there's about a 2-year lag in data. And so certainly call us and let us know, and we can put that into the designation and update it at that time. So community input is always essential. We're always ready to update these at any time. The process does take about 60 to 90 days to complete. We can expedite it sometimes depending on the need. So, but these scores are set for the upcoming National Health Service Corps site certification cycle. That cycle, we'll talk about this later, will open on the 19th. If you have questions about your score, let us know now, because we might be able to submit some changes that would take effect by the time the awards are being made. So we still have some time, even though they're not reflected here. Okay, so these are the mental health professional shortage areas, the entire state again. So rural health clinics, I know that the rural health clinic, CMS, has a recent rule change in the last couple of years, and that we see a lot of rural health clinics offering mental health services, and particularly substance use disorder services. Always let us know about that too. In order to qualify for the programs that HRSA offers, or for the loan repayment programs, a rural health clinic has to offer a sliding fee scale. We'll talk about that later, but if you're thinking of offering mental health services, it's a really good idea to look at your area. We'll walk you through. We can tell you, the number for your business planning purposes. We can use this data that we use to determine the shortages to tell you how many what the increase in uninsured you might expect. And because we're located in the Department of Health, we can also give you numbers on those, your opioid overdose rates, all of that. Anything you need in your business planning processes, we're happy. If we don't have the data in our division, we're happy to connect you with other data, with other divisions within the health department. So, and I say that all on this slide because the mental health professional shortage areas, the score is important for some of the programs. You also go into some of the deeper scores. So substance use disorder programs sometimes take into account if your counties in the highest quartile in the nation for opioid overdose or substance use disorder. This one too has these scores have alcohol use disorder and substance use disorder points built into them. So, we always want to know, again, if your community is changing, we can always reassess at a county at a time. So, okay, any other questions in the chat? I see the number going up. We've got, okay, thank you.
No, I'm
Okay.
sharing some different HIPSA resources and
Okay.
some links.
Thank you. The health professional shortage areas, again, these are, we have fewer of these. We do see trends in dental and dental hygienists, particularly going down. So when we update this one, I anticipate some of these non-designated areas to become designated, and conversely, we'll probably see, some of the areas coming out that no longer have shortages. This particular data set includes whether the water is fluoridated or not. So again, if there's ever a change in the fluoridation status of your water, let us know. We know that fluoridation water is not countywide. You're going to have communities and you're going to have tribal facilities in there that may or not, that's all very important too. We can start looking at a sub-county level data and how it impacts the overall county score. Okay, so all this setup, moving into this. So now, so we'll talk about, I think I have these slides but so as I mentioned, National Service Corps loan repayment awards and scholarship awards or scholarship placement depend on that HIPSA designation and the HIPSA designation score. The J1 you're qualified for a J1 if you're located in a HIPSA or if you're in a medically underserved area. Additionally, all of the rural areas, except for that little slice of Rogers County, are primary care designations. Oklahoma City, Canadian County, some of those areas that are closer to the urban areas are not. We do have a limited number of slots every year that we can use for non-HIPSAs for the J1s. But for Oklahoma Health Corps and the National Service Corps, the HIPSA is the designation. Programs are designed to put professionals in areas where there is a health professional shortage area designation, with hopes of settling the providers in that area that we clear the HIPSA designation. So this is the Oklahoma Health Corps. Again, that's a state loan repayment program.
Real quick before I'm going to ask one more question from the chat. Somebody is curious if we and HRSA work with a company called HIPSA Acumen.
We do not. We are aware of them, that you do not have to pay any type of organization to have your HIPSA score evaluated. That is what we are here for. We absolutely can do it for you for free. That HIPSA Acumen will have to ultimately go through us. So they will have to say, this is the data, that there's no way to go around the state primary care office that's funded by HRSA to submit the designations. So that we do know of them, and they can be helpful in areas if you're just not seeing the HIPSA data being reflected like you need it to be. We're happy to work with them, but we are also happy to work directly with you on this. So one of the things we can do is print off the list of providers that are included in your designation, and you can verify that and say, yes, this person's here. No, this person doesn't take Medicaid. This person moved. This person retired. All of that. And that's where we are. Again, that's our community development piece of it. So we're always happy to go over that. And again, those two, fluoridated substance use disorder and mental substance use disorder and alcohol use disorder. Those are that's additional data that we can put into the system. So the other data, and so this is set in the program. Our system that we use to designate the health professional shortage area automatically pulls census data, and it automatically pulls data from our partners at the Center for Medicaid and Medicare Services. Our responsibility is to verify the data sets. The census data is not really something we can change. However, if you have a community, and this does happen, that they're so small or they've grown and the census data is not reflective, we can work with you to look at, do you have a special population? Do you have migrant farm workers? Do you have any type of, do you have a larger undocumented citizen population that you can see them, you've got counts of them that we can put that data in and do what they call special population designations. So anything that is affecting your healthcare system and the ability of the providers to meet the needs of the population in your area, we can take a look at it. So I hope that answered your question. So please, if you have follow-up questions, we're happy to talk about them and meet with that company too if you've been approached by them. So, okay, so HRSA, this is our state loan repayment. That cycle is closed. We hope to make awards. We think we'll make awards of the total funding. If we don't, we'll be in contact to see if there's another round. But this one is pretty much at the end of this. We will write another application this year to hopefully secure another round of Oklahoma Health Corps. And that one will be focused on mental health completely. So again, the rural health clinics in particular, we're really seeing the need for rural health clinics to offer SUD, substance use disorder services and mental health. That integrated care model works really well and works really well with our managed care setup right now. We're also happy anytime just to talk with you as you're trying to decide whether to offer mental health services or not. We're happy to walk you through what we see in your community. So this one will be mental health care. This is the current site that is closing this week. This is the National Service Corps. So the way, so clinicians that are applying for National Health Service Corps loan repayment, the Substance Use Disorder Workforce Loan Repayment Program, or the Rural Community Loan Repayment Program are putting in their applications now. So the site certification of the National Service Corps site happens every spring after this loan repayment cycle. The process of certifying a site starts. It may take until December to receive the word that you've been certified as a site, but it's always ready there at the first of the year when they start looking at loan repayment programs, these three programs, but also the placement of scholars who have accepted money from HRSA to get through. We have, nurse scholars, we've got physician scholars, students to service, it's called, and they are also looking for placements within our rural communities. So that's what a National Service Corps site certification will do for you, make you eligible for placements of scholars and make your clinicians eligible for these loan repayment programs, depending on the services. So this year, really exciting news. The primary care clinician award has been increased from $50,000 to $75,000. That's in recognition of of the need of the severe primary care shortages. You're going to see, and these, of course, are in primary care designations, and then also a Spanish language award enhancement for any provider who demonstrates the Spanish language oral proficiency. There is a test when they apply for it. They'll check the box. So again, any of your Spanish-speaking clinicians that are proficient in it, make sure always that you're telling them. They check the box. They're provided with the test. If they meet those minimum requirements, then it's a $5,000 addition to whatever award they're applying for in these. So again, that Rural Community Loan Repayment Program, I always want to point out that that's substance use disorder. So again, HRSA is really focusing on the opioid epidemic, really diverting a lot of resources to that. So mental health, is a very, very high priority for our HRSA partners and our Bureau of Health workforce. If anybody has any questions, this is found on the National Service Corps HRSA.gov loan repayment, as is anything you need to go through site certification, There's a site reference guide that will walk you through the requirements and will also help your clinicians or help the clinicians that are that may be looking at this decide which learner payment is right for them. They can only apply for one, so at a time. Okay, so site certification processes. So each year, so about this time of year, we're being told by our federal partners that the site certification cycle will open around May 19th. I highly recommend you going to the National Service Corps site certification page. There's a place you can sign up for an email that will notify you the minute that application process opens. There's a link, you'll go into a portal and you'll start the process. So I will tell you, I don't think I have this in here, but the process is that when the site opens, you initiate an application. When you initiate that application, it notifies our office, and we know that someone has initiated but not submitted an application. At that point, if we're able, we'll reach out and ask if you have questions, if you need technical assistance, and just sort of touch base to see where you are in the process. Sometimes people initiate an application and figure out it's not for them. We can really help you with those decisions and sort of point you in the right direction before you go forward with your application of what it's asking for as we go through that application. When the application is submitted, it also comes to us. It's our office will review it according to the site criteria and that site reference guide. So we're just looking at that reference guide to see if the information that you've provided in the application shows that you meet those requirements for the National Service Corps certification. We do our initial review. We make a recommendation to the National Health Service Corps Division of Regional Operations. They are responsible for making the final determination. If they have questions, they will send you a letter that says, I'm reviewing the site. Here are some areas I need to ask for additional information. And then the process kind of goes back and forth for that. So we may send emails to you as well, asking for additional documentation if something's unclear to us. Okay, so that's the process. It sounds a lot longer than it is, but it's pretty clear. And that site reference guide is the most valuable tool you can have when you're starting a National Service Corps site certification. Okay, so auto-approved sites, I just want to speak to them. Federally qualified health centers, those are health centers that have met the requirements that the Bureau of Primary Health Care sets forth, and they're federally supported by a federal grant, and they're auto-approved. They're monitored by our Bureau of Primary Health Care. They report to them, so they receive this auto approval because of the type. The lookalikes, the same thing. They're operating as an FQHC, but they don't receive the grant funding. They still report to the Bureau of Health Care. They report to the Bureau, to our HRSA Uniform Data System, so they can auto-approve them. Same thing with IHS, the facilities, tribally operated health programs, urban Indian health programs, and federal prisons. They're auto-approved. Immigration and Customs Enforcement Health Service Corps, that's a little bit of a different program. At this point, you're not aware of any of those in Oklahoma. It could be that we're just not aware of them, but we've not identified anything. So eligible site types. Those are those of you that have to go through this process. State prisons, rural health clinics. I've put a little asterisk on there. It's not always clear in our national information that a rural health clinic is only eligible if you offer a sliding fee discount program. That means that sliding fee discount program puts you in the category of seeing anybody regardless of ability to pay. And that's really where HRSA is focused on, access to care for anybody regardless of ability to pay. So critical access hospitals, they are eligible. They do have to have an outpatient clinic. Most of them do, but they have to have an associated outpatient clinic. Community mental health centers, these are in your communities, you see them. State or local health departments, if they meet the criteria. So each of these have to submit applications, and they do still have to meet the criteria to be eligible. But these are site types that are eligible. Private practices, same thing as the rural health clinics, they have to offer a sliding fee scale, and it's time of application. Depending on the ownership of the clinic, you have to have offered the sliding fee scale for 6 months or longer. So there's some specifics in there, and we're always happy to go through those at that initiation point if you're wondering if you're actually eligible. So school-based clinics, mobile units, free clinics, and substance use disorder treatment facilities that are inpatient. So, okay. So inpatient settings, these are ineligible. So any inpatient setting, residential, inpatient rehab, those are not eligible. There's a gap. There's very little loan repayment offered to them. We're aware of it, but this program just isn't meant for that. It's meant for outpatient primary care. The Veterans program has their own loan repayment program. So if you have veteran centers and you're working with them, they should be aware of their programs, but we're also always happy to connect them. The local county, home-based care, even though we know they're doing a lot of care. And then the specialty clinics that are limited to gender identity systems, diabetes clinics, anything like that, they're not eligible. The only exception for the eligibility with limited services are those substance use disorder treatment, OBGYN, pediatric clinics, or geriatric clinics. Those are, we definitely don't want to exclude them from eligibility. So, okay, I'm gonna have to run through this a little bit faster, aren't I? I said it was gonna be quick. So, okay, site requirements located in HIPSA. Laura, how are we doing on time? Was it scheduled for?
It's scheduled for a full hour, so we have 20
Okay.
minutes.
Okay, good. Okay. For some reason, I was like, oh no, had to be, we're at 30 minutes. We could wrap it up and have you call me, but thank you. Okay. Site requirements. Located in HIPSA, you have to be, those maps that I showed, you serve everyone regardless of ability to pay. Again, that's that sliding fee discount. They must accept Medicaid, Medicare where applicable. Of course, for the tribals, they're auto approved too. They have to, they can see their tribal members. They can limit who they see to their tribes and, associated with that. You have to offer in primary care and behavioral health access to those comprehensive services. So what you don't provide on site, you have to be able to refer those patients to sites that are also accessible. You have the appropriate non-discrimination policies. There's copies of those in the site reference guide. And then you have to have a recruitment and retention plan. So this link, how to meet National Service Corps site eligibility requirements, that's your reference guide and everything you need to know about becoming a site. So we're always happy to walk you through those. So
I've also just put the 2023 reference guide in the chat. It's also worth reference or noting that there'll be a 2024 reference guide with few edits. It's not really material like certification material change. They're flushing out more details to reduce confusion.
Yes, so thank you.
A question in the chat, Jana. We do not offer a sliding fee discount program at our RHC. However, we do offer the same charity and financial assistance to patients as we do at our critical access hospital. We have an OB physician who is applying for the loan repayment program. Does he need to use the critical access hospital as his place of employment rather than the RHC?
So why don't you follow up with me after this call? Because we will need to look at the practice and what the charity care policy is. Sometimes they're acceptable. They're not. Just the basic EMTALA is not acceptable. But let's go over those documents, see the policy, and kind of Yeah, let's do, that's one of the specifics that it's always best to call us on so we can go through the process. And if we have questions, we can always reach out to our Division of Regional Operations. So just follow up. Melanie, can you if you put your information in the chat, we'll call you after.
Already working on it here.
Okay, thank you. Okay, so you're going to offer access to comprehensive services. I have appropriate non-discrimination again, and recruitment retention plan. We can help you with these too. Some of these, so sliding fee scale discount needs to be, we need to have, it needs to show up in your data that you've been using some type of sliding fee discount. We may need to make tweaks to it. We may need to ask you to adopt this, but that's in our review process. Some of these others will come back if we review your non-discrimination policy. We have some technical assistance to help you improve that so that it meets the requirements, and also recruitment and retention plan. We have resources. We can help you. That recruitment and retention plan has to address provider burnout. That's a requirement, but we can help you with the technical assistance to modify that recruitment retention plan so that it's in there. So always don't think that if you don't have it in there at the point of application that it can't go forward. That's one of those, we can help you develop that. The only thing, again, as I mentioned, is that you have to show in your data that you have been offering the sliding fee discount. So, okay.
Somebody's also asked when it says serve everyone, does this include self-pay and commercial insured patients? I've put yes. I just wanted to say that for video as well.
Yes, thank you. It does.
So, speak more to that if you'd like.
Yes, it does. So, and of course, if you're not contracted with their insurance, you can see them. So the sliding fee scale is for patients below 200% of federal poverty level and below. If someone has insurance, you have to be able just to see them at your regular charges. So, okay. Health professional. So here's this. I think I've already covered this, but you have to be located in a HPSA that's specific to the clinicians that are applying. So, primary care professionals will use your primary care score. Just those few areas that are in mental health professionals, but not in primary care. Primary care clinicians wouldn't be eligible. Substance use disorder can use either the primary care or the mental health HPSAs. And then if your HPSA is proposed for withdrawal status, you can still submit an application. It might be proposed for withdrawal in the process of an update on our end. Rural health clinics. So rural health clinics can have a HPSA facility score as well. It takes a little bit of data management from the bureau side, but if you don't have a health professional's HPSA score associated with your clinic, you can still submit an application because it's going to be based on the HPSA that you're located in. Because of course, rural health clinics have to have that HPSA score in place. I think that's about it on that. So it's good. Okay, any questions about that? Okay. Again, just brief over, here's your scoring. You've got 0 to 26 for dental, 0 to 25 for primary care and mental. The higher the score, the greater the degree of a shortage. Our federal partners start at the top and fund down to a certain level of score depending on the resources available and the number of applications received for the National Service Corps Loan Repayment Program. The scholars every year, again, they look at what they're able to fund through the National Service Corps. They look at the number of scholars and they determine a minimum HPSA score. So this year it was 14. That's pretty low. So there are scholars looking, have to secure scholars who have completed their training are committed to find a site with HPSA score of 14 or above.
We have another pretty specific question in the chat. Jacob Eason is full of really good questions today. Thank you, sir. Regardless if we are located in a low-income or geographic HPSA, our site would still need to apply and be approved National Health Service Corps site to be eligible for the loan repayment programs and the CMS bonus payments?
No, you only have to apply for site certification for the National Service Corps loan repayment programs. The physician bonus payment program, only for geographic HPSAs, should be automatic because this data is shared with CMS. And if it's not, contact us and we can start those channels to see why it hasn't been coming to you. So, does that answer the question? Mm-hmm. Okay, great.
Jacob, if you've got more specific questions like that, I'm going to ask you for your email address and we can follow up with you afterwards.
Mm-hmm. All right, so primary care, dental, and mental. Within primary care, you've got the mental health designation. Within the loan repayment program, too, there's a pediatric loan repayment program that is attached to a primary care designation as well. There's not a separate score for that, but pediatricians or pediatric health professionals, nurse practitioners, PAs are eligible for the pediatric loan repayment program as long as they're located in a primary care HPSA. So, okay, we're almost through there. Correctional, I'm just going to kind of leave that up there for resources. If anybody has, so the correctional facility HPSA is something that we have to do manually. We'll work with the correctional facility to have the right data to put it in place. Again, the cycle is we will analyze the data and have that HPSA in place for the following year's certification cycle. Okay. So again, comprehensive primary care. So if you're primary care, this is the type of comprehensive primary care that you have to provide: culturally competent, preventive, acute, chronic primary care health services. You do have to be able to make arrangements for the patients to access ancillary inpatient specialty. So X-rays, lab work, those are pretty important in the primary care world. And then, you have to be able to refer at least to specialists. And we go through that in the application. You describe your referral relationship. Okay, same for primary care, only a little bit more, a little bit broader. So primary and behavioral health sites have to be able to ensure the access to specialty referrals, namely substance use disorder. They also have to have a referral relationship to inpatient psychiatric facilities. So just demonstrate that they'll accept your patients or describe what you do. The site application, Melanie just corrects me, does it require still that the sites, behavioral health sites, provide a letter that an inpatient facility will accept their referrals? So, okay. So we realize that they will accept them without an MOU, but for application purposes, you have to have the signatures of that inpatient facility. So as it stands right now, that may change, as Melanie said, that reference guide is 2023. Sometimes we won't expect the 2024 guidance to be posted until right before the cycle opens. That's just, they're still making approvals and that. So check if that guide comes out and it says something different, particularly when it comes to regard with the behavioral health, that's something that changes quite often. We'll say, okay, we're in 2024 now. So always, if I'm, mentioning something that's not in the application, I'll just, shoot us or Melanie an email and we'll say, oh yeah, they took that out of the guidance. So, okay. Medicare 0 to 12, there are maternity care health professional target areas that have their own loan repayment programs. So that's a good one to do. You don't have to do anything for that designation, and your site doesn't have to do anything other than list OB/GYN services on your application so we know that you have those services. Still, if a provider, OB/GYNs, is providing those services, puts in an application, they'll still be funded. It's not, they'll still be funded under that MITCA. So they just have to verify that. So MUAs, MUPs, I've already covered that. And again, the CMS designation for the physician bonus payment, J1 fee, and the J1 visa program. Sliding fee discount. I'm going to really go through these very quickly because this is in your reference guide. But it does apply to the uninsured, the underinsured. It must be based on family size and income and no other factors. So you cannot, one of the things that's on the site, you cannot have a requirement that they apply for Medicaid before they access the sliding fee scale. That's one. And Melanie, don't you agree? That's a common one that you find in there.
That's a very common one.
Mm-hmm.
Or like any type of like anything that would become an obstacle to somebody's like access to the care. If you have any type of questions about that, it's probably best to just reach out to us directly.
You have for the application, you're going to provide a copy of the sliding fee scale. It should be updated to the latest federal poverty guidelines. And it also, you also have to upload your policies for applying that. So everybody has to be made aware that your facility offers a sliding fee scale. You need to have it in your signage. You need to have it in your website. All of those, so that you're known that your sliding fee scale is out there. So if somebody needs one, they know you're there for them. Your policy has to describe how you apply it, who's eligible, your frequency of reevaluation, and the documentation requirements. And then again, like I said, how you advertise the sliding fee discount program is used to increase access to care. Part of the application asks you for your website. And so your website, we really like it to be on the front page if at all possible, that's your sliding fee scale. We see everybody regardless of ability to pay. They're just right on the front of the website. That nominal charge, you have to look at that. That sliding fee scale starts with your nominal charge, and depending on where they fall in the category of poverty, as it slides down the 200, 135%, 100%. That's what you take off your nominal charge, and your you do say what's the lowest charge, and we'll look at that too to make sure that it's affordable for someone at those lower levels of percentages of poverty. And then the description of your collection policies. So all federal qualified health centers have collection policies. Melanie, do you have any advice to offer about those collection policies?
I do. There in the reference guide that I've uploaded into the chat on page 50 through page 56 is it's the appendice C, and it has a sample policy for the sliding fee discount program, has a sample application for the sliding fee discount program, has a sample schedule of fees that utilize a nominal fee that waterfall and cascade down the various federal poverty lines. Of course, they're going to be the federal poverty lines from 2023. But again, in the 2024 reference guide, they will be updated. And I've seen so many organizations take those appendices, put letterhead on them, tweak a little here or there. And those are the examples are for you to use. That is highly recommended that you might do that. If you've got any questions about that at all, just reach out.
Thank you. All right. So comprehensive primary behavioral, of course, sort of the same, your sliding fee scale. I think we've already covered this. There is or was the behavioral health checklist section of the application. We anticipate that will still be there. They might be hopefully embedding it in the actual application process. We don't know yet. There's a very strong chance that those that have asked to be notified of opening that cycle will know before we will that cycle and the material is out there. So, okay. I think that is about it. Sliding fee discount, this is in, and I wanted to put this has some of our what we will do on the application. I put this out here for reference, really, again, for, as this is recorded and anybody to come back for reference. Clinician recruitment, it must promote resiliency and reduce burnout. Those are, we have language and we have resources that we can send you to on those. And I think we're really getting up to that time there. We want to let, and then that's it. So, the benefit again, this is National Service Corps, scholar programs, any of those others that are looking for placement. So, are there any further questions today in that chat? I see that number going up.
So there's one question about where people could access the federal poverty lines.
Oh, right. Do you have
the templates? I can.
If you can drop that in the chat. Mm-hmm.
Yeah, I have there's one file that I've added to the chat, and I can add it again real quick here at the end so everybody can see it. But the pages begin on the templates begin on page 50.
Okay, great. All right. Any additional questions in the chat, or anybody have any questions they'd like to ask? So, all right. Well, thank you so much. And again, call us. These are our emails. You can always call us too. And we're happy to help you through the application process. Again, May 19th that's what we're being told. It's usually open 4 to 6 weeks. We will process and follow up anytime once they're initiated or submitted to us. So, okay, well, thank you. And thank you, Laura, again for the time today. We really appreciate it. And really appreciate our partnership with the State Office of Rural Health.
Yes, thank you guys. And if anyone has a question, please do not hesitate to reach out to myself or Jana or Melanie. Again, thank you guys for your time, and everyone have a great day.
Thank you. Thank you.